My name is Mary Millard. I live in the Baton Rouge area of Louisiana, and I'm a patient and sepsis advocate and a public speaker on hospital-acquired infections. Fall of 2016, and I had some atrial fibrillation at home. I was a perfectly healthy adult and was not sure why it was happening. And we went to an emergency room and they found a 6.3 centimeter aneurysm on the base of my aorta near my heart. And they stated that it had collapsed my aortic valve quite a bit. And so I was admitted right away to have that repaired. What my husband and my doctors had told me after I was discharged from the hospital was that he had found me septic after the open heart surgery. He found me speaking in a confused manner and had a fever and could not hold my head up, and he alerted a nurse. My infectious diseases doctor said my blood pressure was extremely low and my organs were starting to shut down. And on my hospital note, I saw that I had a mortality rate of 98%. The doctors explained to me that I had contracted the sepsis during the ECMO procedure, and they discovered that what had infected me was a bacteria called Pseudomonas aeruginosa. I was actually hospitalized initially for the surgery. It was a total of 60 days in the ICU and 22 days in step down. Being in a bed that long, plus the septic shock, plus the ECMO, it was very difficult to walk and even stand up, and my muscles had been severely weakened. 6 months after my discharge, I started getting random fevers. I didn't think much of it. I thought my body was just fighting something small. And I went back to the doctor, and they had discovered that the Pseudomonas had overridden a lower dose of the antibiotics and come back into my bloodstream, thus making me septic again. And at that point, I was rehospitalized, and they gave me a stronger dose of the antibiotic, which I was on for 6.5 years after that to try to avoid going septic. Post-sepsis syndrome affects your life in so many ways. I used to hike. I used to go to the mountains and run. I used to run with my dog. I'm very limited now in what I can do. It's fatigue. Some days you just can't get out of your chair. It's also confusion, irritability. I mean, all these things that affect your personality that were not there before. And it's very difficult on family and on yourself. I would like to make people aware of how drug-resistant infections connect with sepsis and how so many people actually go septic because they acquire these in different ways, that this can happen to anybody. Anybody who's healthy, anybody who's young or old, it can happen to anybody. I became a patient advocate mainly because became grossly aware of how little the public knows about AMR and antibiotic resistance, and how little they know about sepsis. What I would like to tell healthcare workers about sepsis is timeliness. Catch it fast, catch it early. It creates a lot less bad symptoms for people. If mine had been caught early, instead of going to neurology for a workup, I would have had a lot less amount of symptoms than I do now.